and gentlemen, welcome to MedSynapse podcast series, where we delve into critical healthcare topics. I'm your host, Dr. Nigar, and today we're honored to have a distinguished guest with us, Dr. Mousa Abughoush. Dr. Mousa is a specialist in internal medicine at University Hospital Sharjah with a wealth of experience and expertise. He holds an Arab board in internal medicine, and his contributions to the field, particularly in gastroenterology and neurology, are highly regarded. Today, he will shed a light on the pressing issue on physician burnout, sharing his insights and recommendations with us. Dr. Mousa, welcome to MedSynapse podcast, and thank you so much for joining us to discuss this vital topic.
First of all, thank you, Dr. Nigar, for this lovely introduction. I'm really honored to be part of this lovely podcast, and hopefully the viewers will enjoy this podcast because it will really address an issue that I think as physicians, it's quite a common issue, actually, quite a common phenomenon, which is physician burnout. So hopefully they will find it useful, and looking forward for this podcast. Thank you so much again.
Thank you so much for your time and for being part of this wonderful podcast series.
My pleasure.
Without further delay, let's begin with our podcast. Dr. Mousa, to begin with, what unique challenges do doctors face in managing their workload and well-being?
Well, definitely there are multiple challenges. It's, I would say, multifactorial with different dimensions. As physicians, to be honest, we face challenges at a personal level regarding our personal well-being, our social setting as well, our social commitments, and also you have the part related to the organization itself, the setting where we are actually practicing the medical profession, and definitely you have a very important aspect which is regarding the patient care as well. So it's multifactorial. You have challenges from all of those aspects. So for example, once we think of patient care, all of us believe that patient care is our top priority. We have to provide optimal patient care as always, to do our best and to give it our best at all times. So this by itself, even thinking about it, I believe for most physicians nowadays, it's definitely a stressful thought on its own. So some people would really consider it as a challenge, like I need to do my best, I have to perfect, I have to give it my best shot in order to optimize my patient care. Some people on their own, they have an anxious kind of personality, so this will kind of put them in a loop that they're anxious, like did I miss anything, did I do something wrong? What if I missed that thing and the patient might get worse down the road? So this kind of vicious cycle would cause a form of burnout, like at the personal level, like I'm really doing my best. Secondly, sometimes when it comes to the social level and the personal level, some individuals might have certain family issues as well, personal circumstances that would kind of put an extra load on their day-to-day practice as well. A lot of family commitments as well, which kind of would be a distraction for their thought process and would kind of impact their patient care as well. So even thinking about those commitments would kind of let them wonder, like, okay, this is putting an extra load, an extra pressure on myself, and this in turn might affect my patient care. And also there is something to keep in mind, that when we talk about burnout, there is an emotional component which includes anxiety, stress, depersonalization, loss of personal interest as well. And also there's a physical part. It would really impact your actual stamina, your energy as well overall to be able to perform to your best. So as I mentioned, it's a multifactorial issue. When it comes to the organization as well, depends on the setting really. Some people might not find the best support or the most efficient system or the healthcare system to work on. So this definitely has an impact. If you're in a system that's not quite efficient with a lot of administrative work, so this will kind of consume a lot of the time that would actually you can invest it in developing yourself, enhancing your skills, and even providing better patient care as well. So in summary, I would say it's multi factors are involved, and they come hand in hand. They kind of impact one another, and they're kind of interlinked. So the key is you have to kind of try and address the issue once it's raised. Like, there's an issue, I have to deal with it, and you have to have kind of tools to be able to lead to early recognition as well.
As a fellow doctor, I can certainly relate and agree to all the challenges that you have mentioned. I believe it is essential for healthcare professionals to prioritize the self-care while handling all these demanding workloads at the same time. Now, moving on to our next question, how does burnout affect job satisfaction among internal medicine doctors and patient care?
Definitely there is an impact between the physician burnout and the job satisfaction. They kind of go hand in hand. For example, if you face a lot of stress in your job, you're not quite handling it well, you feel like the environment is not quite supportive per se, so this will kind of create an anxiety in yourself. So kind of you would feel like, really, this is not the place I'm belonging to, or for example, did I really enter the right profession? So you will kind of feel a bit lost. You would feel dissatisfied. So definitely it will have a negative impact on yourself. But a really important point, as I mentioned, you have to realize at the point that, is it really affecting me to the extent that it's affecting patient care? All of us, to be honest, like to be frank, definitely will have some sort of anxiety, some sort of stress during our job. Our job is definitely stressful. But the key is like to have proper coping mechanisms, a good support system, and to kind of from within to feel like, okay, I could have good days, there could be definitely bad days, but after all, you're doing your best to provide the optimal patient care. So this kind of mindset, if you think it in that way, you'll kind of feel satisfied from within that I'm doing my best, I'm doing a noble job to help the patients. So this is a reward by itself. But if kind of things went west, things are really hectic, it's not going as planned, it's too stressful, it leads to burnout, and definitely you will feel dissatisfied with your job, and it will kind of have a negative impact down the road on your career. So all in all, I think definitely it will have a negative impact. If not handled well through the proper channels, definitely it will affect your job performance and your career in general, definitely.
I absolutely agree with you, as this is a very critical concern. Especially as you have mentioned, physicians experiencing burnout, they are less likely to provide high quality care to the patients that deserve it. So I believe we must address this issue to ensure both the well-being of the physician and at the same time to provide optimal patient care. Now, moving on to our next question. Dr. Mousa, have you noticed gender-based differences in burnout among internal medicine specialists? If yes, how can they be addressed?
To be honest, at a personal level, I didn't notice a gender difference rather than personality. I would say it's something subjective. Regardless of the gender, I believe it depends on the individual personality and their overall mindset along with their coping mechanisms. Overall, I noticed there is some tendency in our female colleagues, because most of them, they have a lot of family commitments, a lot of stressors maybe at home perhaps. They're trying to multitask along with the stress of the job. They're trying their best to do that. So I noticed a slight, maybe an edge, maybe on their side. But overall, I would say it depends on the personality. Like some individuals, they have a personality that kind of maybe overthinks. They have a low threshold to handle stressful situations. So this definitely will impact overall the impact of burnout on them. Some individuals might have some degree mild burnout that they can easily handle it depending on their mindset. Other individuals, even with a simple situation, things went a little unexpected or unplanned, they could kind of exaggerate the situation and complicate things and kind of put them in a loop that they're getting into a really intense kind of burnout. So in summary, I would say it's more personality related rather than gender difference. And after all, it depends on each individual and their coping mechanisms.
Dr. Mousa, could you please share some successful strategies for reducing burnout among practitioners?
Well, I would say there are different strategies that can be done. I think one of the most important strategies, or let's say elements, is like to have a good support system both at the hospital or institution that you're working in, and also at your home as well, your social circle, shall I say. Having a good support circle will definitely make a huge impact. Like, for example, you had a long day, you have a bad night, a bad duty, you went home, you need to have your family, your relatives, maybe close friends as well. Even if they're like out of the medical field, they could be supportive. They would kind of help you to de-stress and get out of the mood, let's say. So definitely having a support circle, really your close friends. And another important thing is that if you have any kind of emotions that you would like to express, it's better to express it to whoever people that you trust within your circle, because once you kind of express your emotions, it will help you realize like, okay, there is something wrong. They can give you advice. They can give you advice how to cope with it. And even by itself, just talking about it, you would feel relieved. So definitely number one, have a really good support circle within your environment, whether at the hospital or at home. When it comes to the hospital, definitely you're part of a team. Most of us as physicians, we're definitely part of an organization. We're part of a team. There is teamwork involved. So definitely, like, don't feel shy to kind of share any kind of incidents that feel that your colleagues, maybe you're more senior as well, they might have experience in handling those situations. So they could really provide you with some advice and hints on how to cope with it. Another important issue that we really face during our daily duties is to have a good time management scheme. And when we talked about time management, we can kind of try and prioritize our tasks depending on the most important task and then the least important, and try to be efficient. And most of us as physicians, we have sense of pride. We don't like to ask sometimes a lot, but I'm totally against that. I would really encourage people, like, if you don't know anything, you're not quite sure whether it's something administrative, something medical, always ask for help. When you feel that you really need it, ask for help. There is no harm, there is no shy in asking for help. And I think it would reflect that you're really trying to improve yourself and to be your best version and providing the best patient care. So I think those two are the most important things. Also, another important thing is you can have a good habit, like, for example, exercise, some meditation, any kind of activity that will help you to relax. It would really be beneficial. And try to have a good time off every now and then. I know we have limited kind of time to have the luxury of vacations as physicians overall. I think it's a worldwide issue as well. But definitely there is no harm in having a vacation to kind of get out of the bubble that you're trapped in. So this will really help you to re-energize, to come back with a good mindset, with a fresh mind, to continue with your job.
Now, when it comes to hospitals and medical institutions, how can they support doctors to prevent the burnout?
To start with, there are several options that can be done, and I think one of the most effective one is to be good listeners. Actually, a lot of hospitals, I believe, they can have regular meetings with their staff to have a good feedback, to listen from them, to kind of know like what kind of things can be done better to help ease the job on us as physicians. For example, they can discuss the working hours, the duty schedules, any kind of equipment that can be added to make the job better and easier and to facilitate things. So really have regular kind of feedback and to be good listeners to the actual staff and physicians I think that's number one. That's quite important. Some places they adopt kind of physician wellness program, kind of like you can maybe have a friendly talk with a psychiatrist or a specialist in the field. You kind of have a session of counseling. If you have any issues that you're dealing with at a personal level, it can be addressed, so they can give you with a good counseling session, and you would feel it's definitely confidential, so it would really help you to be kind of like there's someone understanding and listening to me and supportive in that aspect. And professionals who are really expert in the field can really provide good advice. Another important thing to keep in mind is that to have a good compensation system. Like you feel that you're doing your job, you're doing well, and you're being rewarded for that. And the reward could be not only financial, it could be kind of at the psychological level, kind of you feel a good sense of appreciation, like you've done a good job. Maybe every now and then there are some programs, I think like most residency programs, like they choose the best resident of the year, for example. So it's kind of motivating. It's kind of, you would feel a sense of appreciation, let's say. And also the financial rewards, you would be able to support your family, to do your commitments. So you would feel like you're not having a burden on you as well, a financial burden. So this is another important aspect to be kept in mind.
Moving on to our final question of the day. Are there any specific challenges or opportunities for addressing burnout in healthcare with the rise of telemedicine and remote work?
So basically, with the introduction of the telemedicine during the COVID era, it had played a real and important role. It minimizes exposure to the virus, so kind of physicians with certain medical conditions, they're immunocompromised, they won't feel the stress that they're really exposed to a virus that would put them in a risk along with their loved ones. So this will kind of reduce the tension and the stress of thinking about that. Definitely, telemedicine with the advance in technology had made our job more efficient. But on the other hand, some individuals, I would say it's something subjective, dealing with technology is a bit not their kind of point of strength. So on the contrary, for certain individuals, it can actually put an extra load, an extra stress, especially for the more elder physicians, kind of they're more used to the traditional or classic system as well. So kind of it can go both ways, to be honest, but overall, definitely it had made an edge. It had made a huge progress in the pandemic and even beyond the pandemic, reduced the burnout, but maybe for certain cases, certain individuals who are not quite familiar with technology to that extent, it might have added some sort of stress or anxiety, but definitely with good training, with good support system at the institution, this can be easily avoided.
Thank you so much, Dr. Mousa, for your very valuable insights, thoughts, and advice on the issue of physician burnout. Your contributions to this discussion have been very enlightening. Thank you so much for joining us today.
It's definitely my pleasure to have had this chance to express myself. I hope definitely that the viewers will benefit from this podcast. And again, it was really delightful to share this video with everyone. And I'm looking forward for future podcasts as well. Thank you so much for your time.
Definitely, Dr. Mousa. We're looking to have many more podcasts and webinars together.
Thank you so much.
Thank you. And to our audience, we want to remind you that this episode was brought to you by MedSynapse, your source for insightful healthcare discussions. To stay updated with the latest content and to make sure that you don't miss any future episodes, make sure to subscribe to our podcast. You can also register on our website for additional resources and updates on healthcare. Your support means the world to us, and we look forward to continuing this journey together. Thank you for tuning in. Goodbye.